So they suggested an algorithm where it guides the healthcare providers on how to screen and diagnose sarcopenia. So you can actually study this algorithm when you are screening older adults. Right? So this is homework for you to answer is sarcopenia an age-related diseases or syndrome or a geriatric syndrome. Okay? So sarcopenia, the pathology of sarcopenia can be explained in two ways. One is primary sarcopenia that is purely due to age-related changes in the physiological system. And the second one is the secondary sarcopenia, which can be due to illnesses or malnutrition or physical inactivity. So normally for secondary sarcopenia, the sarcopenia is reversible. So there are many non-modifiable and modifiable factors of sarcopenia. As a physiotherapist, we need to identify what are the modifiable factors for prevention, delaying, and treating sarcopenia. So studies on factors among lesions again is inconclusive because of the heterogeneity of the study populations and the use of different cutoff as well as tools to measure sarcopenia. So what are the strategies for combating sarcopenia? Several international and regional guidelines and consensus recommendations on sarcopenia are available, such as the EWGSOP, AWGS, and the ICFSR that provided diagnosis and treatment and the cut-off values for screening and diagnosing sarcopenia. However, these guidelines may be too broad or too specific for use in the clinical setting. So recently, Singapore came out with their consensus to be used among Singaporeans as well as Asian populations to optimize muscle health among the older adults. So the consensus aimed to bridge the gap in the other guidelines. They focus on additional surrogate measure for lower limb strength to represent muscle strength, unlike the other guidelines. Okay, they also propose additional detail on physical and nutritional intervention. They also provide input from multidisciplinary and holistic point of view. They also propose some population-based strategies to combat sarcopenia. So you can see here these two tables. Table number 1, they have 14 recommendations. Table 1 summarize the first 6 recommendations, and table 2 summarize recommendation from number 7 to number 14, focusing on intervention for maintaining muscle health and